the more they talk in the house, the more we'll have something here.
Okay, so let me come to James Sharma. Thank you, So, what was the best thing about this whole community media forum today?
There were lots. I think the question posted. The best thing for this topic was for the citizens to be aware of the new trend government is taking when it comes to citizen financing or helping towards their own health. So I think that was the best.
Okay, let me go to my intake. The whole forum that was hired today, the thing that was there that making good today. Can you tell me what made the whole thing good today?
The one was making good because the way the people didn't tell all that, the doctor didn't tell all that. They can't go to the hospital. When they give them free medicine, you can't lay down. We'll be doing different things. But when you're not free, you will not lay down. You will get your people good. So that one, why it be because that one making them fair.
So that one make
the
program good today.
Yeah, so make the program good because we know now. I care my small money.
All right, let me come to my sister here. I want to know from you how some of the bad things. What was the worst thing about this whole community media forum that you can highlight?
The worst thing is that what I think someone asked a question or talk only. Whenever a patient go to the hospital, the nurses like on shift, they will tell you say, go impart this, go impart this. When you try to get your way out, they will call you, they say, come, don't go far, I get it here. Yes. And not good. We like you go to the hospital, if you do such thing, and then somebody go again and white people, I myself, I will get a belief that, yes, indeed, you got a trust in the hospital, but they are taking it, selling it personally.
Okay.
Yes.
Yeah, let me come to you. The whole forum that was hired today, what was the bad thing, the way we organized it, that you think that you saw today?
All the forum that I saw today were very okay, good. But one of the things I see about the hospital, it got some nurses always on duty. They don't even have manual approach for some people that get into the health sector. And if they are prescribed the medicine, the drugs, they give you the paper for you to buy the medicine. They know within a set that they get the medicine. And they will say outside, when you go outside, they call you, say, oh my brother, come, I get it. So that made people to feel that the drugs are always people complaining on within the hospital. That made people feel that they're the one who taking the drugs and selling the same drugs to us that are going for treatment. So these are some of the things I see in the back.
All right, let me go to Mr. Smith. How often do you listen to radio in Gbarpolu, especially the ones of Gbarpolu?
It's very difficult for me to listen to radio in Gbarpolu because I try 2-3 times. Sometimes I use my phone to listen to radio, but I can't get it just on time.
Okay.
So I
just... You can listen to radio in Gbarpolu, yeah? What about Gbarpolu? Or radio code, are you talking to? Yeah. You can listen to radio one more time. How often do you listen to the voice of Gbarpolu?
Well, I always listen to the radio, and I think those things people are measuring on the radio is going a long way with us. That is helping us because those awareness that you people are getting, more especially the one you people organized today. I mean, it was a very good thing that we're getting to know today that we the citizens, the drugs that are coming. Can you imagine we're paying 42%, and government, the whole government was depending on. We're just thinking that government doing everything. But we ourselves, we pay some money for our own health. I think we should increase this money so that we ourselves, every one of us in Gbarpolu, will enjoy good health.
Okay, let me come to Shemo. So, what impact do you think this will have on the community forums? This community media forum we have today, especially on the
It will have a good impact. One of those impacts will be the people will be knowledgeable that health these days is not free. That you can just relax on government, less subsidy they are getting to the health sector because you listen to the statistics that were read. The government is putting 16%. So, and knowing full well that
the government is about the people. It's the people that make the government. So the people now should be what they think is going to be.
All right, my sister, what impact do you think this community media forum will have on the life of people in the county?
What impact this meeting will have on the life of the citizens of Gbarpolu County, right?
Yeah, what kind of help will give people?
Yes, it will help us a lot. Because what we learn today, if we just practice it, we put it into practice, we tell others about it. We tell others that whenever you go at the hospital, when the people ask you to pay money, don't refuse. Pay the money and then you will get a referral treatment. When we carry the news around, and a person too will carry the news to his or her community. Before you look, the news will spread, and then at least it will help us a lot. We'll not be buying medicine that is updated from those that sending the medicine out there when they had some.
Okay, Mr. Clark, let me look at the impact do you think this media forum will have in the community?
This will have a great impact on our people, on the life of our people, more especially when it comes to the healthcare system. Because if the very institution that was represented yet go into that very meeting, they will decentralize that information. They will give the information out, and at the end of the day, when we practice it, like what our sister was saying, at the end of the day, when we all practice it, we get to know that, oh yes, this thing will be done the right way. I can assure you, things will change from worst to best.
All right, let me hear from you on the impact.
Yeah, a particular issue will be of great impact because some of the things that people more know about today, if they can hear about it, they will take it to their various towns and villages so that we can know what to live by, what to do. Because if I pay a huge amount of money for something I know I will benefit from, then that means that it will really be of help for other people and for my family and for other children.
All right, let me come to Madam Lydia Bala. So overall, we're about to close a whole brief interview focused on discussion. Overall, do you feel that this CMF or the Community Media Forum has or has not improved citizen engagement in your district or community? Do you think it helped to improve citizen engagement or not?
Well, it's happy because we're just starting. It's happy, we're just starting. We need to spread out in the various districts. Gbarpolu is not Gbarpolu County. We got 6 districts in Gbarpolu County. So it need to go there so others can know. And even we are talking about the financing medicine, we have to show exact price. I think we didn't talk about that. Exact price, how much people will be paying when you get to the hospital. Because sometimes you will go, you do the awareness, the person will ask you, when you think how much when I go to the hospital, how much you carry? You don't know. So you really need to come up with it to be our awareness that will be able to, educate the people on it. When they are coming, they should be prepared. Anytime they're ready, they should be prepared. They'll have to come into the hospital.
Okay, Ms. Azor.
Yeah.
Do you think this whole CMF, do you think it helped to improve the citizen engagement in the district or in our community? Do you think it helped or not?
Oh, it helped a lot because from the tenor that we saw here today, can you imagine people came here and would drink water, and that was very important because people got a signal that when they come to the kind of gathering, you're going to get their money. But it's not about money. The one you taught us today, it will go a long way because we tell other people. We tell other people, and those people too will be able to tell another person. You see, so the good thing about it is that the awareness will go from today, it will go a wide range in the county.
Okay, let me hear from Gbarpolu. Gbarpolu, do you think the program we came on here today, do you think it helped to talk to the citizens in the county?
It helped. Myself, I will be telling my Bele people that when they come from Bele, they come because they can be patient here. We go, so now it can be free. Because we can be talking, we say, you're being the patient, man, a free thing, you're being the patient, and the people then can make medicine. So they can be the patient, it be free. But the way now we hear it, my son will be talking that I say no, they're not free now. Until when you be coming, you be team.
Okay. Mr. Smith.
Yeah.
The CNF has or has not improved citizen engagement. Do you think it helped to improve citizen engagement in Gbarpolu, or it has not at all?
Positively, it helps to improve the interaction of our community. In that you saw the tender, as my brother regularly said, and for me, that's my first time even attending such a program. And I saw the participation, and I saw the different statements, the feedbacks. I heard it, and that proves to me that this really actually helped the people of the community. And like my sister said, they should not only be limited to Gbarpolu township or district, not just a Gbarpolu city, but let it be spread to other districts, to other communities, where they will find it necessary to know that this thing is about ourselves, not about any other person. So it really
Let me
improved.
move to my sister.
Thank you.
What else do you think can be done to ensure that citizens feel listened to by their stakeholders, at least our lawmaker? What else do you think we can do to make sure that our people they listen to us?
What I think we can do, we have to engage them. We have to maybe walk to them and tell them. And like for the way I come into Gbarpolu on the radio station, they will also listen. And I know that they will feel impressed, at least to do something.
Okay, Mr. Clark, what else do you think we can do to ensure that citizens feel listened to by different barriers?
Yeah, for me, one thing I feel our citizen will be in good position of doing is we set a time frame to meet the superintendent who is the president of this country, and also we start to engage the media. At some point in time, we put ourselves together, we send two females, we start engaging the media. At some point in time, we get together, we do a voluntary thing, we carry on awareness in the market. I believe when they're hearing this type of thing, while the awareness is going on, journalists is there and put it on the radio. In the morning when they wake up, they will hear our voice. They will know that we're for business. While we're engaging the media, at the same time, other people engaging the office. So everywhere. So I think for me, that's the practical solution now.
Let me also hear from you when I say questions. Do you think, what else do you think can be done to ensure that citizens feel listened to by their stakeholders?
Yes, just to add on to what my brother was saying, we send 2 or 3 persons at the radio station, at least in the morning, play, in the afternoon, play, in the evening you play, because some people they work early in the morning, they will not get time to pull their radio on to listen to what is going on. In the afternoon when they come back, when they pull their radio on, they will hear what has been played on the radio station. And then sometimes too, you do awareness talk show. You do the awareness. Sometimes you do like drama in the community. Put few groups together. You organize yourself. You practice on what you're going to do. When you get into the community, big drum, you'll see other people coming to listen to what you go when you're for. I will stand up. The drama team go, they play what they went for, and then they can pick from them. At least that one alone, it can help also.
Okay, thank you so much. The last question is open up. Anybody that want to answer, you can raise your hand up and then you talk about it. Alright? So, is there any other feedback you would like to share? Any of you would like to share about the community media forum, its impact on you or the entire citizens in Gbarpolu County? Yes, sir.
Yeah, the only thing I would like to say about that is that, like my sister rightly said, Gbarpolu is not Gbarpolu County. These are programs you are staying in the various districts. And now, even if not all the towns, but the headquarters of the districts, I mean, they call similar group, and talk to them. And then so that the message will go a long way. See, I think that will be a great impact that will have.
Yeah, okay. To buttress him as well. What I did not see, I don't think it happened, or what is happening, I don't know. But it's not to pre-inform maybe the citizens, and then maybe we'll get more tenor If you wish to, you have a more tender.